Hi, I'm Lynn Shurtleff. I am an independent insurance agent here in the area. I have been in this area for over 30 years, specifically Hampton, so I am local. I carry all plans. This seminar today is not a sales seminar, it's for education only. So just want to let you know that we're going to be going over Medicare. So let's get started. There are two different types of supplemental coverage that you can get to go along with your Medicare. And the first one we're going to talk about is the Medicare Advantage plans. They combine all of these three parts and equal Part C. They've been around for a while, and they're not as widely known as Part C, but they are called the Part C. So it's A plus B plus D equals C. So with a Medicare Advantage plan, it combines your A and B and usually includes your prescription coverage. In our area, we do not have the type of Medicare Advantage plan that allows you to have a standalone prescription plan. So you either have it included in your plan or you don't have a Part D at all. They are also offered by private insurance companies. They are not through the government at all. And they are competitive, so their benefits will vary. These are the plans that are going to include the things that Medicare does not cover, like vision, dental, and hearing. So to be eligible for a Part C or Medicare Advantage plan, you have to be enrolled in Part A and B. You have to have the B. So if you've opted out of B, you can't have a Medicare Advantage plan. You can have a Part D, just a prescription drug plan with just A, but you cannot have anything more than that, including even a supplement if you don't have B. You have to live in the plan service area and not have end-stage renal disease. Something I just found out, that is not going to apply for next year. They are taking away that exclusion for the end-stage renal disease for folks for next year, for 2021. Where it says you must live in the plan service area, these are network-based plans. They're HMOs and PPOs. So they are going to require that you go to a network providers or have no coverage or pay more when you go outside of network. So that's the plan service area. Costs for these plans, they can change from year to year. Again, that period in the fall is to review those changes for the next year and see if that's still the right plan for you. And once again, you must continue to pay your Part B premium. Most of the ones we have do include your prescription drug coverage. If you have Part D or coverage for prescriptions, say through the VA or TRICARE, CHAMP VA, or through a retiree plan, you can get on a plan that does not have the Part D, and you will not be penalized down the road to pick one up. The VA does count as credible coverage. Depending on the coverage that you have through a retiree plan or through TRICARE, the TRICARE and CHAMP VA, they usually do count as credible coverage, but with a retiree plan, it would have to be reviewed to see if you would not be penalized or not. Coverage is limited to the service areas, whichever area you are in. It could be broad, it could be small. It just depends on what the plans are that are available where you are. You may be required, and most of the time are required, to use network doctors and hospitals. Types of Part C plans. The types that we have in this area are the first three listed there. We've got the HMOs. What a HMO is, a health maintenance organization, means that you have to go to network providers or have no coverage unless you have special permission. So that's network providers only. A PPO, a preferred provider organization, means that you can go out of network and still have coverage, but the provider has to agree to accept that coverage as out of network, and you are going to pay higher out-of-pocket costs. Special needs plans, we have two types in this area now. We call them SNP plans. Those are going to be for defined populations, such as folks that have Medicare and Medicaid. Those would be their specific plans that are designed for them. We also have a chronic SNP plan now in this area for folks that have diabetes. But once again, you don't want to assume that those are always the best for you. You want to make sure you review which plan is going to fit your needs the best. We don't have any of the HMO POS plans in our area right now, but that is similar to the PPOs, but it is not everything that you can go out of network for, only certain things. And once again, they do have to agree to accept it, and you are going to pay higher out-of-pocket costs. Private fee-for-service plans, we do have those available in Virginia still, but not here, and we don't have any medical savings accounts for Medicare coverage. So if you have any questions, please contact me. You may email me, call me, let me know. We can set up individual appointments to go over your situation specifically. Once again, I am an independent agent, so I carry all of the companies and will work to get you on the best plan for you. You can also contact medical care if you need my information, and then we'll go from there. Once again, I'm Lynn Shurtleff. I am a local independent agent. I do carry all companies, and if you need any help with anything, even if you have been on Medicare for many years and have questions or need some assistance with your plan or need to review for next year, just give me a call or email me. Thanks for watching and have a good day.